If you've been told that you have a retroverted uterus or a tipped uterus or a tilted uterus, you could be worried that it's going to impact your fertility or your ability to carry a pregnancy. These are common worries, and there are so many myths to bust about this. So if you have this diagnosis and you're worried, you are going to want to watch this video. I'm Dr. Lora Shahine. I'm a double board certified OB-GYN and reproductive endocrinologist helping people build families for almost 20 years. And I have helped so many people understand a diagnosis of a retroverted or tilted uterus and understand what it means for their fertility and their ability to carry a pregnancy. If this is you, I'm excited to help you today. In this video, we're going to go over 5 main topics. Number 1, we're going to talk about what is a retroverted uterus or a tilted uterus. Number 2, we're going to go over how common it is. Is this something like really common or really rare? You'll know. Number 3, I will let you know if a retroverted uterus impacts your fertility. Topic number 4, I will let you know if a retroverted uterus impacts your ability to carry a pregnancy. And number 5, I will leave you with what I tell my own patients when I diagnose them with a retroverted uterus, so that you know what I say. Now, of course, you always have to talk to your own doctor about your personal situation, but I will let you know what I tell my patients. Topic number 1, what is a retroverted uterus? This is talking about the position of the uterus in the body. The uterus can either be anteverted, pointed up towards the bladder, or kind of the front of the abdomen, your belly button, or it can be retroverted and pointed back towards the spine or the rectum. So here is a model of the uterus kind of sitting in the body. This is the vagina up here. This is the uterus, little ovaries here. And in the body, the uterus is usually sitting between the bladder up front and the rectum or the spine in the back. And so again, if it's anteverted, it is pointed up towards the front, towards the bladder. And if it's retroverted, it's pointed back towards the spine or the rectum. That's it. It's the position of the uterus, and it's, are you going frontwards or are you going backwards? Most people find out that they have a retroverted uterus because they have an exam, whether it's from a pelvic exam or an ultrasound. The person doing the exam might say, oh, you have a retroverted uterus or a tilted uterus, and just sort of leave it at that. And it's often those patients that think about it later and say, oh, well, is this causing any of my symptoms or my fertility or my pregnancy issues? So it's usually something that's just sort of casually noted on the report from the ultrasound, or someone casually notes in a pelvic exam, and it really does not usually impact someone clinically. But if you look up retroverted uterus, you'll see that a lot of people kind of talking about it will say it, oh, well, it could be associated with some symptoms like pain with intercourse, back pain with menstrual cycles, bladder issues, and discomfort using tampons. I would say most patients that I know have retroverted uterus have none of these symptoms. So I don't want you to worry if you have been told you have a retroverted uterus and you're reading about this on a website. You might have those symptoms and you might not, but a lot of people with a retroverted uterus have no symptoms whatsoever. Topic number 2, how common is a retroverted uterus? Well, it's about 25% of people have a tilted or retroverted uterus. I used to tell my patients, oh, it's no big deal. It's like being right or left-handed, but that's actually not correct. I looked it up, and 10% of the population is left-handed. So 25%, or 1 in 4 people, actually has a retroverted uterus. So it's more than what I've said, but I've usually tried to say it like, oh, it's no big deal. It's like being right or left-handed. Fewer people in the population are left-handed. Fewer people in the population have a retroverted uterus. It doesn't usually impact your fertility or pregnancy. Oh, I guess I'm giving away the next topics, but I really try to reassure people that it's just a normal position and anatomy the vast majority of the time. But keep listening, because there are some things that a retroverted uterus can be a signal for. Topic number 3, tilted uterus, retroverted uterus, and fertility. Listen, there is no evidence that shows that somebody with a retroverted uterus has difficulty conceiving. I can see how someone might think, oh, well, maybe it's hard for the sperm to swim a certain way, or, maybe, it's difficult to, for the tubes to reach around to get the egg, or I could see, we're going to worry about whatever we're going to worry about, but there is no evidence that just having a retroverted uterus has any impact on fertility. It's just the way somebody is born. There is something important to think about, though, because sometimes The reason somebody has a uterus that's pointed towards the back is because they do have something making the uterus point towards the back that can cause difficulty getting pregnant. So let me explain. So if you have a uterus that's pointed to the back because it's fixed because of scar tissue, maybe from endometriosis or from a previous pelvic infection, or you have large fibroids, which are benign tumors on the uterus that a lot of people have, and they do not always impact fertility, but they could be large enough that it's sort of pushing the uterus back towards the spine. So if somebody has an anatomic issue, an inflammatory issue like endometriosis, scarring, big fibroids that's kind of making them have a retroverted uterus, then it's really the issues that are causing that displacement of the uterus that could be related to fertility, but it is not just someone that has a normal anatomy, just kind of pointed towards the back. That in and of itself is not a source of fertility issues. Topic number 4, pregnancy and a retroverted uterus. No evidence that having a retroverted uterus impacts your ability to carry a pregnancy at all. The uterus grows, the body changes, organs, everything accommodates a pregnancy. And if you're starting off with a uterus that's pointed back, tilted back, you can still absolutely carry a pregnancy. Topic number 5, what do I tell my own patients? Don't worry about it. Just because we found that you have a retroverted uterus, a tilted uterus, a tipped uterus, that it's pointed back towards the spine, in and of itself, just that issue does not impact your fertility, does not impact your chances of having a beautiful baby. Now, if I'm suspicious of other things, like I know that patient has endometriosis, I know they have a history of a pelvic infection, I see other things on an anatomy scan, like a large fibroid that could be displacing it. If we can tell that the uterus is really fixed, like it's hard to move, like I'm worried about endometriosis or scarring, and the uterus happens to be pointed backwards, like that's a different story. But for the vast majority of my patients, I say, great, that's just who you are, and it's not going to impact your fertility or your pregnancy. I'm going to have some links in the description below to teach you a little bit more about retroverted uterus. I really hope that you learned something today. I hope you are reassured if you have been told you have a retroverted uterus, a tilted uterus, a tipped uterus, that the vast majority of the time it is not going to affect your reproductive health. Like this video if you learned something, comment with questions that you have, and be sure to subscribe to my channel so you get my weekly video on reproductive health. And as always, wishing you love, luck, and pineapples.